A skilled nursing level of care, if you are entering into what most people call a nursing home. And when they say 24/7, what they mean is they will have an RN on duty. That RN is usually a director of nursing, some kind of leadership capacity, not necessarily hands on care, probably not answering call lights. You'll have an LPN who's usually a charge nurse who will usually either be giving the medications, maybe doing wounds. Again, probably not always answering call lights. The people who are giving a lot of the direct care, answering call lights, and spending the most time with people in a skilled nursing facility are CNAs. There's also a level in there called CMT of people who give medications. The cost for this level of care is right now in Columbia from $10,000 to $13,000 a month. People often ask us as Navigate Wellness, what does skilled nursing look like? If I need a skilled nursing level of care, but I want to stay at home, what does that look like compared? So now you have skilled nursing, the traditional model. Ryan, what would you say it looks like when we have a skilled nursing level person in our
Yeah.
home?
Well, I think if you look again at the traditional model, they again, like you said, it's one or two RNs, and then a bulk of your care is happening on the lower end of the training level, the CNAs, and they see a lot of patients in the same building, and so they drop all these people in a small area so they can care for a lot of people. What the model isn't necessarily set up for is for the individual to be have the greatest outcomes possible. So when we start looking at people that are having that level of need, we want to try to introduce the highest skill of care possible at the highest frequency of care needed to be
And
successful.
the lowest ratio, one on one.
That's right. So anytime we're at somebody's house, you have our full attention. It's not just one nurse, me, it's our whole group of nurses that have different expertises that we've developed by working in the system. You know, whether that's we're seeing people once a day, twice a day, three times a day, to where you're seeing that highly skilled individual that knows that individual and the ebbs and flow of what's going on. Now, in between that care, depending on any individual's needs, you might have to supplement with, CNAs. We call it companion care level. You also have to manage the things about the independent levels of care that are needed, as well as the assistant level of care. For us, taking it from where we were working a lot with independent levels of care, we started dabbling with assistant level of care, and now we're getting the staff, the right staff to handle skilled nursing level of care.